Well, hi there, everyone. My name is Dr. Jeff Schroeder, and it is my pleasure to serve as your instructor for this course, Principles of Healthcare Research NU601. This course will focus primarily on the process of nursing research. We won't be focusing too much on statistics, although understanding statistical concepts will be a part of this class. But really, this class is focused on understanding the purpose of and the process of developing good nursing research. Each week I'll be posting a little weekly video that will both introduce the upcoming week's concepts or content, and also review the previous week's discussions and clarify any points that sounds like they might have been a little bit misleading or a little bit confusing in the class. I'll be participating in discussion along with you each week, but these videos are just a way for me to kind of have sort of like a wrap-up session like I would do in any face-to-face class. Just gives me a little bit of face time with everybody. You get to see my face and realize that there really is an instructor out there that is participating in class along with you. And I think that it kind of helps to make the class a little bit more personal, a little bit more lively. At least that's my hope. And so here in week one, we're going to start with a very general, broad overview. And we're going to talk about nursing research. And a lot of questions about research as to, why is nursing research really all that important, or at least why is it important when we have all these other kinds of research studies that go on? Why does nursing have to have its own body of knowledge? And part of it is just because if you look at the degrees that we either have or are working on, if you're a bachelor's of science in nursing or a master's of science in nursing, the key term there is science. We're all scientists. The idea is that we're all scientists looking at what is the best way for us to do, or what do we really know about our profession? What do we know about nursing care and how it relates back to patients? And so in this first week, we're going to discuss this from a very broad perspective and talk about the two basic types of nursing research. Now, these are very general types. There are really many different types of nursing research, but the two general categories are qualitative and quantitative. Quantitative are those things, or that research that we do that is statistically valid and actually involved with collecting numbers and collecting data that we can look at and that we can analyze from a statistical point of view to try to show either causation or show correlation or show hard numbers. Qualitative research is a little bit different. Qualitative research is not so much focused on hard numbers per se, but is really more research that focuses on finding information that we don't really know, or we don't really understand, the full ramifications of a particular phenomenon. And so if we want to learn more about the values, attitudes, and beliefs of subjects or of individuals within a population, we tend to use that qualitative methodology. And so that's really how we're going to talk about that. You're going to be reviewing two articles. We'll be reviewing these articles in the future weeks as well. But the Beck post-traumatic stress disorder article and the Kokalba et al. Efficacy of hand massage. These are two fairly straightforward examples of both qualitative and quantitative studies. And so you're going to be looking at them from that point of view and talking about were these approaches appropriate? How are these approaches similar? How are they different? And were they appropriate for these two given studies? Your first initial response to the discussion question will be due by Wednesday, and they'll always be due by Wednesday. Follow-up discussions are always due by Saturday night. I followed the rubrics pretty closely, both with the discussion questions and with the assignments in this course, so please review the rubrics. For full credit for 100%, posts that exceed the minimum expectation are required. Minimum expectations are 2 responses provided during the week to peers. Responses should reflect an ongoing discussion. In other words, you shouldn't be posting all your responses on one day. Participation throughout the week will yield a higher credit score, or a higher score rather, for participation credit than those that are just coming in and just kind of giving a couple short responses, not really showing or reflecting an ongoing discussion. So just kind of be aware of that. That's again, it's reflected pretty well in the rubrics. I think that everybody is pretty well oriented to the online classes and how they're set up. But just to let you know that those are the standards that I follow. Each of these videos would generally be between 5 and 10 minutes long, somewhere along that line. Like I say, it's a way for me to answer questions, a way for me to just kind of make the class a little bit more personal. I do tailor these videos to each week. They are specific to this course. In other words, I don't have them canned and just upload them. For each course that I teach, they are specific to this course, so they will deal with feedback from the discussions from this actual cohort. So if you have any questions, please feel free to let me know. It's best if you post them in the Ask Your Instructor form in the class. I will be checking those at minimum of every 24 hours. If I do go longer than 24 hours, just go ahead and send me a follow-up email in case something got lost or I forgot, because I am human and that happens sometimes. But I do want to be available to you and answer questions anytime that they come up. Easier to just post them in the class and have me answer them there, because that way everybody can get the benefit of the answer. It's way easier doing that than answering the same or very similar questions for 4 or 5 people. So post them in the class. It is usually better for everybody. So I look forward to participating in class along with you. I hope look forward to having a good class. If you have any issues, questions, go ahead and let me know. And I will see you all in the discussion forums.